I want to welcome you to University Life's forum on the spring vaccine booster updates. My name's Donna Lynne. I'm the Senior Vice President and Chief Operating Officer at Columbia University Medical Center, also the University COVID Director. I'll be introducing our panelists in a minute. But thanks for taking the time to be here today. We've got questions that we received in advance. I'm sure we'll get some during this presentation, and we'll do everything we can to get to as many as we can. I want to thank University Life for hosting today's event. As you know, University Life is the student lifeline and the hub for information, resources, events, initiatives that support not only our academic mission, but also inclusion and belonging, health and well-being, sexual respect, and community citizens. So hats off to Dennis Mitchell and to Joseph Greenwell and the entire staff at University Life for organizing this and continuing to reach out to you to give you assurance both about how safe the campus is and the protocols that we need you to follow. It has been almost 2 years that we've been having a conversation about COVID-19, and I think we all hope we're on the backside of the epidemic, but we still have a number of protocols in place and requirements to keep our campus safe and to deal with whatever comes at us as we go forward. So thank you for everything you've done, your resilience, I know your compassion, and your endurance, quite frankly, as we've gone through this. I do think we ought to celebrate too that Columbia's campuses are amongst the safest place to be. Our COVID transmission rate is below the outside community here in New York. And you'll hear today, our more recent COVID testing that we've been doing over the last couple of weeks with a large number of students coming back has been less than 2%, and we're seeing significant changes in hospitalizations and other indicators in the outside community. So what I'd like to do is I'm going to turn to Nina, who is supporting us, and to go through a very brief survey. We have 6 questions that we would like you to answer, 5 questions we'd like you to answer. And then we're going to just sort of assess where we are as a community so that I can get a sense of the emerging themes, and our 2 speakers can also do that. So you should see the first question: have you gotten your booster shot? Yes, check yes or no. Your second one, if you haven't, do you know how to get it, where to go to get it? The third question, indicating how important you believe it is to get the booster shot. Your fourth question, as you get through these, will be, do you have questions related to testing positive in the last 90 days and the booster mandate, which we will cover in the presentation? And then finally, we're going to want to get a sense of whether or not you believe that we're providing you through all the various channels, adequate information about the vaccine and the booster. So if you can take a couple minutes to look at these, some are yes and no, some of them are on a scale. And then once we have locked in your results, we'll get Nina to summarize where we are. Okay, so let's just quickly go over the results. We have about a 2/3, 1/3 split in terms of whether or not people have gotten their booster. It looks like the majority of you do know how to get your booster. If you are in that group that does not, you can go to the Columbia COVID-19 website to find out where to get the booster, and Melanie will also address that in her remarks. On the next question, if you can scroll, I'm going to scroll down. So a lot of diversity in terms of the answer to the question on a scale of 1 to 5, 5 being not important, 1 being not important and 5 being important. We have an interesting split across the board with an equal percentage of people saying it is important on the extreme side of 5, and then on the extreme low of 1. So that's an interesting data point. There are some number, just about a third of the people on the poll said that they do have questions about getting their booster if they've tested positive in the last 90 days. And we'll answer that question. And then on a scale of 1 to 5, of people being happy that we're providing critical information, we have a pretty even distribution on the 1 through 4 scale. And then at the high end, only 36% thinking that we provide, strongly agree in terms of the information. So let me kick back to, and I did get a question in the chat box, and I want to be clear because you're going to see Melanie and Wafaa. Those of us who are in private offices with doors closed do not need to wear masks. I also teach, as do others. As you know, the indoor masking requirement for faculty, as long as you can maintain 6-foot distancing, you do not have to adhere to. But today, as I walked through my classroom, I put my mask on as I was leaving to go to take a phone call, for example, or if I get up to go to the ladies' room, or if I get up to as I come in or go out. So the masking policy is one that we strictly adhere to and will be adhering to through at least the end of March. So as I said, what we're here to do today is to share with you a little bit of the data that we have around what's happening with Omicron, and then to get into more detail on testing and the booster. So those of you who submitted questions in advance, thank you. And those of you who are adding them to the Q&A box, as I said, we'll try to get to them. This is also being recorded. So University Life will be sharing a video in the coming days and giving you an opportunity to view this conversation on the website and on other social channels. So I'm going to welcome back two people who are not mysteries to you, and I'm going to introduce them, and we're going to start with Dr. Wafaa El-Sadr, who is a university professor of epidemiology and medicine, the director of ICAP in the Mailman School of Public Health, and she's also the director of Columbia World Projects. Wafaa is not only our own in-house expert, but relied on by people internationally and nationally in terms of her expertise in COVID as well as in other areas. So Wafaa, let's turn it over to you.
Thank you very much, Donna, and it's a pleasure to be with you all today. And let me share my screen. And okay, can you see my screen, full screen?
Yes, we're good.
Okay, great. Thank you very much. And a pleasure to be with you today. And I'm going to give a very brief update on COVID-19 and try through my presentation to answer some of the questions that we got from you prior to this webinar. So let me very briefly tell you about the status of this pandemic at this point in time. And I'm going to focus on the United States and New York City in particular. So as you know, we've been experiencing, the global community has been experiencing a severe surge due to a new variant called the Omicron variant. And you can see here over time, the numbers of cases up here on this vertical axis is that we have experienced in the United States a very massive surge in terms of the numbers of cases of COVID-19 over the past several weeks. But in the United States overall, we have peaked and now are experiencing, and we've peaked essentially as of, maybe 3 weeks ago thus far. And we are now experiencing this rapid decrease in the numbers of cases that are being reported in this country. Similarly, in New York City, also we experienced, if you look at the numbers of the daily numbers of cases over time, this is the rapid increase in numbers of cases that was experienced with Omicron, with a peak experienced here on about January 3rd or so, and then a rapid decrease in terms of numbers of cases that we're experiencing now as well with the Omicron surge. More important than the numbers of cases are the daily hospitalizations. And you can see again that in New York City, we experienced this rapid increase in hospitalizations However, this was followed by, again, a rapid drop in terms of the daily numbers of hospitalizations. Importantly, what we have seen throughout the Omicron surge is this very important and durable difference. And this is the number, this is in terms of the hospitalization rates in New York City. And you can see here overall in gray, the citywide increase with Omicron, citywide increase in hospitalizations. But you can see also very distinctly the difference we're seeing in orange between those who are vaccinated and the rates among those who are unvaccinated in purple. So it tells you that we've seen a surge in Omicron. It was very rapid, large numbers of cases, of course, associated with hospitalizations, but then very rapid decrease and an effectiveness that we kept seeing in terms of protection from vaccination overall against numbers of cases, but also hospitalizations in particular. So what are some key characteristics of Omicron that I think will be just important to keep in mind as we move forward? As you are well aware, I'm sure it is more transmissible variant of the virus, meaning it's easier transmitted from one person to the next. It's also that a lot of data that tell us that fortunately, while it's more transmissible, it is less virulent. And what that means essentially is that it causes less severe illness. So big proportion of people who get infected with Omicron have no symptoms at all. They don't even know that they're infected unless they test themselves or get tested. Mostly they have mild symptoms. And then even if people are hospitalized because of severe symptoms, they tend to have less severe illness. And also during the hospitalization, they don't need oxygen. They're less likely to require being on a ventilator or respirator. And also they tend to have a shorter duration of hospitalization. So most of the hospitalizations have been amongst the unvaccinated, but even when you compare even COVID with Omicron amongst the unvaccinated versus with Delta variant, the illness appears to be less severe even amongst the, certainly much less amongst the vaccinated, but less severe amongst the unvaccinated compared to Delta. So let's move on to an important issue, which is how well do our vaccines and our boosts, and why do we need boosters? So we have a lot of data that have shown us thus far that after receiving vaccination, being fully vaccinated, over time, there's waning of decrease in the protective antibodies, the protective substances in our bloodstream that protect us from getting infected, getting ill with COVID-19. But what about boosters themselves and the vaccines? So I'm going to show you here very briefly some data that really answered that question of how well do our vaccines and boosters work. And these are data from the overall from the United States, from several municipalities in this country. And they looked at really over time, again, what's happening in terms of numbers of cases and what's happening in terms of death from COVID. And what you will see here in these curves is that the solid line here are amongst the unvaccinated. So you can see the waves that we saw, the Delta wave amongst the unvaccinated, and now here the Omicron wave amongst cases amongst the unvaccinated. And then contrast that down here amongst those who are vaccinated, fully vaccinated, and then here amongst those who are vaccinated and boosted. And if you look at the same time, at this curve here, the increase in numbers of deaths with COVID amongst the unvaccinated in the solid line, and then and again contrast that with amongst the vaccinated, amongst the people who are boosted, it's almost zero, way down here at the bottom. So what we can see here from these data from this country, that when we look that the unvaccinated persons had much higher, more than about 14-fold higher and 50-fold higher risk of getting COVID itself, as well as of death. And also that the protection against infection and death during the Delta and the protection against infection with Omicron was highest. The protection was highest amongst people who had received the booster dose. So we'd see the importance from these data of the booster dosing. The booster dose has an additive effect in protecting people from getting sick with COVID, and so that's for individual benefit, but also because they prevent infections, that means that they also as well have benefit in terms of decreasing the amount of virus in the community. So getting vaccinated provides individual benefit, but also provides benefit in terms of decreasing the risk to society overall. And that these are other data that try to answer the same question about the value of vaccines and boosters, and in terms of preventing infection and hospitalization. This is from LA County, California, a large study that did look the same thing. You can see here over time, and this is the period here on this end of Omicron. You can see over time, again, in the solid line, the increase in the numbers of individuals who are with cases of COVID amongst the unvaccinated versus amongst those who are vaccinated. And this is amongst people who are boosted. And similarly here, when we look at hospitalizations over time during the Omicron phase in January here, December and January, you'll see again much higher rates of hospitalizations among the unvaccinated compared to the vaccinated, but then an even further decrease in terms of the risk amongst those who are boosted. So we have an additional benefit from the booster doses for the individual who's getting the booster as well as for the people around them. And please keep in mind that getting boosted is not solely for the variant that's circulating now. It's to protect oneself from the variants to come in the future. Let's move on to another question that we get asked is, what about protection from convalescents? What that means is, what about people who've had COVID in the past? Are they protected as well or better than people who are vaccinated? And this is complicated figure here, but what you can see is that if you just focus on this figure here, is that the protection, the height of these bars here, which tells you how much of the protective antibodies in the bloodstream, you can see that it's much higher amongst those who are both vaccinated and convalescent. And it doesn't matter in which order, whether convalescent then got vaccinated or vaccinated got convalescent and then convalescent and then got COVID afterwards. And this is again against Delta and against Omicron. If you just look at convalescence overall against Omicron, you can see the low levels of protective antibodies amongst people solely who are convalescent, who've had prior COVID. So this is what tells us, and we anticipate that this would be the same with convalescent people from Omicron, is that the vaccines or the boosters have significant added value. What about the other question that is of interest to some, and which is the issue of effect of, what about long COVID? Many people have raised the question, is well and good to be protected, to try to of course seek vaccination and booster to prevent getting COVID infection and also to prevent severe illness. But what about if somebody actually develops COVID when the risk of long COVID? And there are some, just to let you know that we're learning more and more about this long COVID. And one of the factors that's been identified recently is that the more severe COVID you have, that's a risk factor for developing long COVID thereafter. And therefore, getting vaccinated and boosted, which results in less severe infection, less severe COVID, if you get it, that bodes very well that people actually who are vaccinated like this are less likely then to have long COVID, because they're more likely to have a milder form of COVID. Do we have data that actually answer that question about vaccination and long COVID? And the answer is yes. There are data here from a study that was done in the UK. And what it shows essentially is that for people who are vaccinated, there was a 41% decrease in the risk of reporting long COVID versus people who are unvaccinated. So we have good news about the value of vaccination in preventing long COVID. And this is another study that was just done. And this study confirms the same thing, is that it shows essentially that those who have received 2 doses of the vaccine, less likely than unvaccinated individuals to report any symptoms of post-COVID. So this tells us again the importance of vaccination, both in terms of preventing the symptoms of long COVID and vaccination leading to less severe illness, and therefore the risk of long COVID is much lower. So what about looking forward? Just a few summary notes. Obviously, Omicron has peaked in New York City and US with rapid decrease now we're seeing a rapid decrease in transmission in New York City and in this country overall. And while vaccine effectiveness overall is decreased against Omicron than it was against Delta, protection against hospitalization and death remains intact and is further enhanced with a booster dose. And keep in mind that the booster doses are also as well very important because they protect against the potential next variant that might come down the line and also decrease the risk of transmission to others as well. And the evidence shows that vaccination also decreases the risk of long COVID if breakthrough infections occur. And then ultimately, I think, and we can talk about this in that discussion, is that ultimately Omicron may pave the way for reaching a new state of equilibrium with COVID-19 pandemic because it's highly transmissible, it causes milder illness, and because of the effectiveness of our vaccines and boosters. And it may allow us to move to what we call from epidemic state to more of an endemic state, meaning in more of a state where we can learn how to live safely with COVID-19. I'll stop here.
Thank you,
thank you
Wafaa.
very much.
Thanks. And we are going to get to your questions. Melanie's going to wrap us up with a little bit of a discussion about where we are with testing, but we're definitely mindful of the fact there's a lot of questions out there that we want to circle back to. So Melanie?
Great. Wafaa, if you could just stop sharing.
And I'm sorry, I didn't give Melanie a proper introduction, but I guarantee you that you all know who Dr. Bernitz is. She is the Senior Vice President for Columbia Health and is really been one of the key leaders going forward, not only in testing, but in boosters, vaccines, and flu shots. And we're going to get to some of your questions.
Thank you, Donna. Thanks, Donna, and welcome everyone. And for many of you, welcome back to campus. We're delighted to see our campuses reinvigorated with your presence, and my gratitude to you all in terms of what you have done and continue to do to keep our campuses so safe. So I always like to start my presentations with a quick snapshot of what's happening. This data is shared every Monday on the covid19.columbia.edu website. And you can see, and this is actually was week 4 of our gateway testing program. And you can see of almost 9,000 tests, we had a 1.88% positivity rate. So really mimicking very much what we're seeing in New York City. We had an additional 113 external reports. So these numbers are really good. And again, showing us to be very far down the right side of that curve after our surge, very similar to the New York City data that Wafaa shared. I wanted to just share a couple of reminders about the testing program. The first is the reminder that this is the final week of gateway testing. All students on all campuses are expected to have a gateway test before the end of this week, before Friday. So after Friday, anyone who has not completed gateway testing will have a red pass applied. The only way, obviously, to revert that red pass is to get your gateway test. So hopefully you're able to schedule those for this week. We keep adding capacity to the schedule, so don't get stuck with that red pass. After gateway testing, we move into our surveillance mode. Oh, just a reminder what your gateway requirements are for our residential undergraduates. There is the 2-pronged gateway test. The deadline is to get the first one by Friday, the second one by next week for our undergraduates who are residential, and everyone else within 72 hours, but again, by Friday. We move into the surveillance testing part of our program. Regardless of your vaccination status, everyone participates in surveillance testing, and that is a random sample. We've used this throughout the pandemic to really understand the prevalence of COVID on our campus, so we'll continue to do that. If you're selected for a test, you must get it within 2 weeks of the email. The dates will be provided. We continue our wastewater surveillance in our residential buildings, and obviously there is additional testing from anyone who has not yet completed their vaccination. Those numbers are very tiny. It's only applying to a handful of international students who haven't had access, and anyone who has an approved medical or religious exemption has to test weekly. Just reminders, please don't come to our testing centers if you're having symptoms. Contact your Columbia Health or Student Health on Haven, or go to a city testing location. Obviously, these are mass testing sites, and the safety of everyone accessing them is paramount. For any of our tests, they do have to be done at our location for the gateway and the surveillance requirements. And something that we're really emphasizing, if you've had a recent positive PCR test in the past 90 days, you're considered compliant with all of our testing requirements for a 90-day period. So we ask you not to retest. If this applies to you and you haven't uploaded that, please upload that to the Secure Columbia Health portal so that we can mark you as compliant for 90 days. This does only apply to PCR tests, does not apply to antigen tests. So if all you had was a positive antigen test, you're still part of the program. Should your PCR test come positive, we discuss it and then we will exempt you for the 90 days. And again, just a reminder, please schedule your appointments. The schedule opens 7 to 10 days in advance. We are not currently accepting walk-ins. We wanted to share some at-home testing guidance because this has really become the mainstay of testing for many of us, and many of you are already using these quite well. But these are the over-the-counter tests that are available. And these are rapid antigen tests where you take them anywhere at home or wherever you may be in the world. And you generally get your results in 15 to 30 minutes because these are done just at home without going to the lab. They are used regardless of symptoms, regardless of vaccine status. And there's a whole bunch that are available now across the US. We've listed some here. The website certainly provides others. But we wanted to share with you some common indications for self-testing and when to test, because the timing is really important. So if you do have symptoms, using a home test immediately is really, really helpful. If you don't have any symptoms, but someone you've been in close contact with has known or probable COVID, actually waiting to do that test is most important. About 5 to 7 days after the exposure, testing immediately is actually too soon and sometimes a waste of that test. And another good time to test is if you know you're going to be participating in an activity where the risk of transmission is high, such as a large indoor gathering, like a concert where there's no masking, or if you're going to travel to see an elderly or unwell relative. And then it's good to test really close to that event beforehand, so you know your status before you go. And then 3 to 5 days after the activity when potentially you could have had exposure. We don't recommend routine ongoing testing without symptoms, particularly when prevalence is low, because then they become quite insensitive. How do you get these at-home tests? As you're well aware, covidtest.gov is now providing 4 free at-home tests to every household in the United States. Orders take about 7 to 12 days. I've heard that people who ordered on day 1 are starting to get these now, but you can go to the covidtest.gov to order them. For students who are living in dormitories, particularly, you may not be able to order through the web just because of the way that the US Postal Service classifies buildings. So the number here, the 1-800-232-0233 number, is the way to go about that if you are in one of those buildings where you've been unable to order on the website. And secondly, and we'll talk about this in a moment, if you're enrolled in the student health insurance plan, you can buy tests and get them reimbursed. And I'll mention a little bit more about that. What to do when you're taking a home test. Follow the instructions exactly. Each test is a little bit different. So the way you swab your nose, the way you put these tests into the card or the liquid is different. So make sure you follow the instructions. Some of them have videos as well. But if that test comes out positive, it's likely detected the virus and you likely do have a current infection. Please notify us at COVID Test Trace so we can provide you with resource information. And if you have symptoms, you isolate for 5 days from the date of symptom onset, where the first day of your symptoms is day 0. You then count an additional 5 days. Let your close contacts know, and obviously wear a mask. If at the end of 5 days you're asymptomatic, you're allowed to end your isolation period, but you must wear a mask everywhere, indoors and outdoors, for an additional 5 days. If when you do this test, you were just doing it for screening purposes and you have no symptoms, the day you do the test is day 0 and you isolate for 5 days. If you do these home tests and they're negative, you may not have had an infection, but it's not 100% accurate. So if you are still symptomatic, we recommend that you repeat the test, maybe in the 24 to 48 hours to increase the confidence of the results, and keep wearing a mask and avoiding contact with others while you have symptoms. Certainly, if you're able to get a PCS through local testing sites, that's also recommended. But if you just do a screening test, you have no symptoms and it's negative, you're unlikely to be infected. And you can go about your activities. Again, many ways to get these tests other than the government website that I shared. Many pharmacies and retail stores have these available, and you can now get reimbursement through all health insurance companies. The student plan and any other plan, US-based plans, is covering 8 at-home tests per month for each person on the plan. So you need to find out how to get reimbursed. The Aetna student plan, you can go to the Aetna website and you submit your receipts for reimbursement. There's also numerous sites, even outside of the university, tents, urgent cares, and other walk-in sites where testing is available. So just shifting gear, just some reminder on the vaccines, the booster mandate. As you're aware, my apologies, the booster deadline has been extended to February 28th for all those who are eligible. Obviously, if you're not eligible, meaning it's not been 5 months since your mRNA vaccine series or 2 months since your J&J, then you're okay until you reach eligibility. That date is different for those who are working in healthcare settings and our clinical students. That deadline is February 21st. But if you have not yet uploaded your booster, and we know that actually many of our students have not yet uploaded their booster information, please do so as soon as possible so we can get that processed for you. The way to do it is for our Morningside students through the secure.health.columbia.edu, for CUIMC students, Student Health on Haven. In both cases, you go to your immunization files under medical clearances. Be sure, please, to not only enter the dates of your booster, but upload the documentation. A copy of your vaccine card is necessary as well. For those applying for exemptions, please, for medical exemptions, you will need to provide the documentation if this is a new exemption request. For those who had an approved religious exemption for the initial vaccines, that remains in effect for the booster.
So Melanie, I'm just going to ask, maybe we can wrap because we've got so many questions left. I know you've got important updates, but these slides will be posted on the University Life website. And I'm going to switch to some of your questions.
No problem.
And Melanie, we'll start with you because we have a couple of questions. We have a question about the flu vaccine and why are we mandating it? And also, are there any health risks associated with getting the booster and the flu shot, which is often done at the same time?
So the flu vaccine, this is the second year of the flu vaccine mandate. For the whole university, it's something we've actually done for many years in clinical settings. And it is really, again, about harm reduction and prevention. Concurrent flu and COVID would be a worst case scenario. So reducing that risk is really the emphasis. In terms of risks of getting both vaccines, these are completely different vaccines. They're not related at all. The flu vaccine is a killed virus vaccine, so really very, very benign. And then obviously the COVID vaccines work differently. They're an mRNA vaccine or viral vector vaccine. So getting the two together is completely fine. You don't need to separate them. You can actually get them on the same day without any risk. Side effects of either vaccine are not increased because of getting them together.
Great, thank you. And then one more question for you, and then I'm going to turn to Wafaa. And of course, the two of you can tag team on some of the booster questions. But this is a question about testing. And the question is, why is surveillance, the Columbia surveillance testing program, necessary? And should we not rethink about maybe prioritizing testing only for those people with symptoms?
And that's a great question, and certainly one we've been continually discussing and adapting as we've gone through the pandemic. So we use the surveillance testing. It's a small sample size, right? Depending on where we are, it's part of our monitoring plan, just to kind of get a pulse of what's happening. And I think that's the reason I shared the information on the rapid at-home testing, where we think about symptomatic testing now with the ease of getting rapid at-home testing. It's actually more beneficial than having a centralized location. If you're unwell and you're symptomatic, the best place to be is at home. So having tests at home and using them actually is a priority. But I agree with whoever asked that question. This is something we discuss multiple times a week and certainly have been nimble and flexible in the adaptability of our program as the pandemic changes and the needs of the campus change.
Great, thank you.
The idea is to, of course, share with you and the results of the surveillance testing, because in a way it is a random sample, largely. And it gives us, like I said, we have our finger on the pulse in terms of what's happening overall on the campus.
Great. So we have a whole variety of questions about the booster that I'm going to pose to our panelists. And a number of them relate to natural, what people are calling natural immunity. And a question about, why aren't there more studies about the impact of natural immunity, and why are we just not acknowledging that perhaps that is a sufficient enough protection against COVID-19? And Wafaa, I think you did address this in your remarks, but I want to put an exclamation point on it, as they say.
Yeah, no, there are several studies. It's not that there are no studies. There are several studies that have shown again and again that the protection from what we call convalescent individuals or people with COVID infection are inferior to the protection that's provided by the vaccines themselves. And that in people who've had COVID, getting vaccinated essentially brings added protection to them. That's been shown in several studies. It's not just one study. And that's the reason why we recommend that everyone get vaccinated and boosted, irrespective of whether you've been diagnosed with COVID or not in the past.
Great. A couple of people have asked about, existing medical conditions and or the fact that they may have suffered, whether it's malaise, it's chest pains, it's other kinds of reactions to their 2 doses or one of the 2 doses of the Pfizer or Moderna vaccine. And given that, should they see a doctor before they get the booster? Should they apply for a medical exemption? What's your advice with respect to those medical conditions? Maybe Melanie wants to answer this.
Yeah, no, we've had lots of conversations. So I think there's some good news here. People who had and these are actually in the realm of expected side effects to the vaccination, what you're describing. These are well-documented, expected, short-term, completely reversible side effects of vaccination. And many folks reported these after the 2nd dose of a 2-dose series. A lot of that is to do with the spacing of those doses. Remember, they were given 3 or 4 weeks apart. The good news is with the booster, that's given 5 months later. So what we're finding is actually the reaction to the 3rd dose, the booster dose, is usually less or nothing at all than in those 2nd dose individuals. So certainly nothing to worry about. No need to see a doctor. As I say, these are expected. These are not allergic reactions. These are side effects. And just knowing what to do if you get them, they can be treated with over-the-counter medications and are short-term, usually within a day or so, resolved completely.
Great, thank you. We have a question, a pretty simple one. I'll answer it and let the panelists take a breather, which is, when do you have to get the booster? So there's several answers to that. As you saw from Melanie's slides, the deadline for getting your booster is February 28th. However, there may be people who have only recently gotten their 2nd shot, and you do have to allow 5 months in between your 2nd shot and your booster. So there is a box on the app. There's a checkbox on the app and on the Reopen CU that allows you to indicate that you're not eligible to get the booster because 5 months hasn't expired between when you got your 2nd dose and the booster.
And just to say that our students are not uploading through the app; they're uploading through the Student Health Portal. Our compliance is actually pretty smart on the Student Health Portal. So if you're not eligible by dates, you are still deemed compliant as we run our compliance. You'll only become non-compliant when that 5-month period has passed. And we will obviously give you a little grace period within which to get that vaccine. So we are not going to, come February 28th, if you only got your 1st dose within the last 5 months, you will not have a problem. You will remain compliant. The system has got that built in.
And just to mention quickly, for people who got the J&J vaccine, it's 2 months since that dose. So
yeah, and a related question, and I think Melanie covered it mostly, which is, if you get the booster vaccine, we don't upload your information for you. You still have to go through a process of declaring that. So that is not just because Columbia did it, whether it's Columbia Health or it's Columbia Doctors, you still have to go through the active process of uploading it. A couple of other questions that I want to share with the group. So is there going to be a 4th booster, Wafaa, and will Columbia contemplate, perhaps a mandate on a 4th booster?
Well, I think it's, again, this is one of those questions. The only group that we are recommending a 4th dose, not a 4th booster, but a 4th dose, are individuals who are moderately to severely immunosuppressed. They are recommended to get a 2nd booster, essentially, which is the 4th dose of an mRNA vaccine. And they should get that 4th dose or the 2nd booster 6 months after, at minimum 6 months after their 1st booster dose that they received. We don't know what's going to happen in the future. It obviously remains to be seen in terms of emergence potentially of new variants and so on. But what we're aiming to do is with the booster doses is to maximize the protection so that in the event of a new variant, people will be protected.
Great. We have another question, which is for students who are on online programs, why are we mandating the booster?
So
Melanie?
we don't differentiate between online and on campus because we're all part of the same community. It doesn't matter where we are located. We're all representatives of Columbia. And as such, we are all being good public health stewards and protecting the community wherever we're located.
Right, thank you. There are a number of people who are asking questions about either they or perhaps some of their colleagues and friends have tested positive recently for COVID. And, what is the recommended period of time in which you should wait to get your booster? And the second part of the question is, why isn't Columbia doing what some other universities are doing, which is they are in fact saying you don't have to get your booster until 90 days after. So Melanie and Wafaa, I think you probably both can tag team on this one.
We can. And we please understand, we have examined the data and what's happening in all of our peer schools continuously and in great detail. There is actually no definitive guidance out there around the 90 days. That is a number that doesn't have meaning at all. So not quite sure why people have chosen that, but we have looked at data and CDC guidance and other national institutional recommendations around this. And it really shows that the only time period you have to wait is while you are in isolation and recovering. And once your symptoms have resolved and your isolation period has ended, you can get your booster even, within 10 days of your Omicron infection. So that's the guidance we're following. Obviously, with the extension of the deadline at Columbia and us being so far off the other side of the curve after the surge, it does allow you to make a decision if you had COVID over the holidays to wait maybe a 4-week or a 6-week period, but stick to within the deadline, obviously, to remain compliant with the university requirement. Again, not this whole definition of natural immunity that Wafaa can share does not necessarily define ongoing immunity, particularly to variants we don't yet know about.
And it's kind of interesting, this 90 days, we've been asking ourselves, where did this come from? We don't know because there are no data to support the 90 days. I think it may be the only need to delay for 90 days is if someone had COVID and was treated with monoclonal antibodies, then they should really wait for 90 days after receiving the dose, and then they can get the booster. But that's the only recommendation that exists.
And if that is a situation you are in, that is certainly a provable medical exemption. If you receive monoclonal antibodies, we know, and then we would mark you exempt for 90 days. So in that situation, please submit a request for a medical exemption with the dates and documentation of the monoclonal infusion.
Thank you. There's a question, and it's been repeated a couple times. So we've talked a lot about the reasons why the booster is important. Are there studies, Wafaa in particular, that you could share with us that say, the booster, there are some downsides to getting the booster, whether it's, it's reactions that a number of people have identified. We've also had a couple of questions about scarcity of the booster, in particular, not so much in the United States where it's plentiful, but in other places. So any physical data around negative health consequences of getting the booster, and then the more general question around distribution of a scarce resource.
Yeah, I think what we have seen is based on Melanie addressed this, is that there's no evidence that suggests that the boosters is associated with more severe side effects than the usual kind of adverse events that you see with vaccination overall. So we have no reason to believe that there are some unique kind of worse adverse events or side effects from getting a booster dose. I think the issue of scarcity of vaccines globally is a real one. And many of us, including people on this call, have been really advocating very strongly in terms of making vaccines available to the global community. It's a huge issue that we're getting a little bit better based on more recent data, but we have a long way to go, particularly for the African continent, for example. But nonetheless, in the context that we are in now in the United States, with the availability of booster doses, and with the knowledge we have thus far of the value, the benefit of booster doses, it compels us to this is what compelled us to put the booster mandate into place.
There's a number of questions about either stratification of some of the data that you presented, Wafaa, by age group, but certainly comments that, are we looking at our decision making relative to students generally, obviously, under the age of 30, are we being driven by, a much older population?
Well, I think it's a good point, because we know that COVID-19 tends to be more severe, obviously, in older populations, and older populations tend to have also comorbidities, other medical conditions that then lead to COVID-19 being associated with more complications. There's no doubt that the older individual is, and the more they have an underlying condition, that the risk is increased. And therefore, of course, the benefit of the booster and of the vaccination, the booster is more pronounced. So that's kind of what the data show. Nonetheless, I think based on the data and based on knowledge that even young people, some may have underlying conditions as well, they may be at high risk, and also because of not just the individual benefit to the person who's getting boosted, but the protective benefit to the community around them. I think those are the reasons why we're recommending the booster dosing for everybody across the age groups. So it is weighing the benefits and so on that we gain by getting a booster dose versus rare potential side effects.
I'm going to wrap up with one final question, and the question has come to us about, are there some specific metrics that we're using as we make some of the decisions, whether it's about masking or it's gathering sizes, which we now have relaxed, including for non-affiliates. I know that was one of the questions in the box. But Wafaa, could you speak about our monitoring plan, which is on the website?
Yes, and certainly our monitoring plan has also evolved over time as knowledge has evolved, and also as the status of our community has evolved. So now we are a fully vaccinated community at Columbia, and by the end of this month, we will be aiming to be a fully boosted community as well. So I think the most important metric that we are keeping an eye on is the metric of hospitalizations amongst people who are vaccinated, because that's really in New York City as a very important measure that's most relevant to us. So we're keeping an eye on the level of hospitalizations among vaccinated individuals as our primary metric. Then, of course, there are other metrics that we keep an eye on. Hospitalizations overall is important. We also keep an eye in terms of transmission rates in the community, and also transmission rates amongst our own Columbia affiliates. But the most important one that is of paramount importance now are hospitalization rates amongst vaccinated individuals in New York City.
Great. Thank you, Wafaa, and thank you, Melanie. I just want to remind everybody before we wrap that all of the resources and the information that we've talked about today is available on the COVID-19 website, www.covid19.columbia.edu. Please familiarize yourself with that as you're coming back to campus. And it does change periodically, as you've seen, as I mentioned, the gathering size, food, et cetera, just our recent changes that we've implemented as of this week. I want to thank both of our panelists for sharing their expertise. They are incredibly busy, but we know how important it is for us to continue to communicate and to hear your feedback around some of the policy decisions that we're making. And thank you all for your questions. We've gotten a substantial number both before and during this session, and hopefully we've gotten to most of those. And again, if not, we always look at the questions and try to respond to them in subsequent updates to the website. So University Life, again, thank you for your sponsorship and support. You can always reach them. I know a couple of people had questions that we couldn't get to and actually asked to talk to somebody. If you email universitylife, one word, at columbia.edu, you can seek some of those answers. And in addition, there are many other events that we're sponsoring through the University Life website that you can get by going to that. So thank you so much, and have a wonderful evening.